friends, I'm Dr. Gangarathna, rheumatologist in Mangalore. Uh, Today I'm going to talk a little bit on a condition called SLE, systemic lupus erythematosus, or also known as lupus. So what is SLE? SLE is a chronic systemic autoinflammatory disease. By that what I mean is it is a problem of your own immune system acting against yourself. So because it is a immune system problem, it can affect from head to toe. So common symptoms are that you may notice some red rash on your face. We call it as malar rash, mainly red rash on your cheeks. Along with that, you may notice ulcers in your mouth, some skin rash on the scalp, loss of hair, loss of weight, loss of appetite, fever. Along with these symptoms, you will notice joint pain, joint swelling, and if not treated at right time, it can affect your internal organs. So by internal organs, I mean there are a lot of patients who we see as lupus nephritis, lupus affecting their kidneys, and they may be dialysis dependent or waiting for transplant. Or in other scenarios, we may see interstitial lung disease, so the SLE affecting their lungs, thereby affecting the heart with the pulmonary arterial hypertension, etc. So the symptoms are variable. SLE is a great mimic, so we always ask symptoms from head to toe, and depending on your symptoms and your disease extent, we start the investigation. So common investigations are blood tests. So initial blood tests to look at your hemoglobin, platelets, liver function, white cells, kidneys function. Along with that, we test your urine and get what we call imaging, suitable imaging, just X-ray, ultrasound. If necessary, higher investigations, maybe even sometimes MRI, brain, etc. if we think your lupus has affected the brain. So, once we do the investigations, I should mention the blood test called ANA and ANA profile, because many of our patients come to us only once they have had these investigations done to have a confirmation of their diagnosis. So after these tests, once we diagnose you with SLE, we cannot take it lightly, because it is a condition which is chronic. By chronic it means it may last forever. So the treatment will be targeted based on the severity of disease. So if your disease is mild according to us, the treatment may be just one or two. Initial treatment is most of the time steroids. I see my patients worrying about steroids so many times, and I try to reassure them that we give steroids only at the right dose and right duration of time. So along with steroids, we give hydroxychloroquine, disease modifying agents, and if the disease is not controlled, then we give them higher medications called biologics. Along with this, depending on the system involvement, as it is a multi-system disease, management is multidisciplinary. So we may refer you to other specialists like neurologists, pulmonologist, cardiologist, dermatologist, nephrologist, or even all of them. So the treatment will be based on the disease extent, and once we start the treatment, we recommend regular blood test and urine test to monitor the disease. It affects women of like 15 to 40 years of age. So what we see the problems are that it affects their education, may affect their married life, they want to conceive, they want to balance their disease, work at the same time. So we try to do our best to help those patients. Equally, we try to advise about planning their pregnancy, and we take the help of obstetricians regarding this. There are a lot of associated conditions, and recurrent miscarriages is one of them from antiphospholipid antibody syndrome. So once we give you a diagnosis of SLE, please do not take it lightly. Please follow our instructions as it is a chronic condition, but it is a manageable condition. Have a positive outlook and it can be managed. Thank you.